The following segment is sponsored by Northern Nevada Health System.
We're at Sierra Medical Center with Dr. Devang Desai, who is a cardiologist here, talking about an interesting procedure, doctor, the transcatheter edge-to-edge repair, or the acronym is TEER, T-E-E-R. What is that?
So, in our hearts, we have 4 heart valves. Right? These valves are designed to transmit blood through the heart in a very systemic way. Unfortunately, over time, with more birthdays under our belts, these valves will go bad. And one of the valves is the mitral valve. And that valve typically starts leaking backwards. So the blood goes forward, and unfortunately, those leaflets don't come together, so blood goes backwards. In that scenario, many patients will need something done for that structural problem. One is obviously open heart surgery, where we can go in through the chest and repair that valve or replace it. But some of our patients are prohibitive for open heart surgery due to age, due to other factors, and therefore we can go through a catheter-based approach and essentially clip those 2 leaflets together in the middle. So when they close, they're going to stop instead of prolapsing backwards. So it's a way to repair that leak through a catheter-based approach.
And what kinds of patients would benefit from that approach?
Sure. And so typically, like I said, initially the surgical approach may be the best approach because we've been doing it a long time. There's good, robust data. But some of our patients are just simply too sick or too frail or have other contraindications to the surgery. So this is a great alternative option for a less invasive procedure.
Okay, so when it comes to implants, what types of implants are offered at Sierra Medical Center, and then how do they differ?
Yeah, so, fortunately, we're able to do a lot of different procedures today. We can do TAVR, which is an aortic valve replacement procedure through a catheter. We can do TEER, obviously, what we talked about. We also have a procedure called Watchman, where we're occluding the left atrial appendage. I think today we have a whole breadth of procedures available for the structural heart arena in cardiology.
And the good news is, if you're faced with this, the procedure is a lot less invasive than it was 10, 20 years ago.
Absolutely.
Yeah.
Absolutely. I think it's a great option for our patients.
All right, Dr. Desai, thanks so much. I really appreciate it.
You bet.
And for more information, just go to our website, which is mynews4.com.